Hyperlipidemia. Hyperlipidemia is a group of metabolic abnormalities resulting in combinations of elevated serum total cholesterol, hypercholesterolemia, elevated low density lipoprotein, elevated triglycerides, hypertriglyceridemia, and decreased high density lipoprotein. Up to 50% of people may have elevated cholesterol. These abnormalities are the primary risk factor for atherosclerosis and coronary artery disease. Pathophysiology and etiology. Primary hyperlipidemias. Genetic metabolic abnormalities resulting in the overproduction or underproduction of specific lipoproteins or enzymes. These are rare but tend to run in families. Primary hyperlipidemias include hypercholesterolemia, defective apolipoproteinemia, hypertriglyceridemia, combined hyperlipidemia, dys-beta lipoproteinemia, polygenic hypercholesterolemia, lipoprotein lipase deficiency, apoprotein C2 deficiency, lecithin cholesterol acetyl transferase deficiency. Secondary hyperlipidemias, very common and are multifactorial. Etiologic factors include chronic disease such as diabetes, hypothyroidism, nephrotic syndrome, liver disease, obesity, dietary intake, conditions such as pregnancy and alcoholism, medications such as beta blockers and diuretics. Consequences: atherosclerotic plaque formation in blood vessels causes narrowing, possible ischemia, and may lead to thromboembolus formation. Result in cardiovascular, cerebrovascular, and peripheral vascular disease. Clinical manifestations usually asymptomatic until significant target organ damage is done. May be metabolic signs such as corneal arcus, xanthoma, xanthelasma, and pancreatitis. Corneal arcus is ring around cornea, significant in patients under 50. Xanthomas is cholesterol deposits on the skin. Xanthalamus is cholesterol deposits on eyelids. Chest pain, myocardial infarction, transient ischemic attacks, stroke, intermittent claudication, arterial occlusion of lower extremities. Diagnostic evaluations in screening of cholesterol and HDL may be done on non-fasting basis. Total cholesterol TC and high density lipoprotein HDL and base treatment and follow-up of lipoprotein analysis LDL. So we have to check total cholesterol TC, HDL and LDL. This assessment obtain history of chronic disease, medications and cardiovascular risk factors such as smoking, family history of premature coronary artery disease CAD, postmenopausal and so forth. Obtain diet history, inspect for xanthomas is XANTHOMAS, xanthomas, xanthalamus XANTHALASMAS, xanthalamus, corneal arcus CORNEAL, corneal arcus ARCUS, corneal arcus. Xanthomas is cholesterol deposit on the skin. Xanthalamus, cholesterol deposit on eyelids. Corneal arcus, ring around cornea, significant in patients under 50. Examine for signs of peripheral vascular disease, decreased pulses, cool, pale extremities, loss of hair and shiny skin. Examine for carotid bruit and obtain ECG for ischemic changes. Management, correction or control of secondary disorders such as diabetes, alcoholism, hypothyroidism. Multi-dimensional approach including diet, exercise, weight loss and drug treatment. Lifestyle modifications, decreased fat intake, increased exercise and risk factor awareness and reduction. drug therapy, and if patient already has coronary artery disease, diet and exercise therapy, drug therapy should be instituted. Drug therapy options: bile acid sequestrants such as cholestyramine or cholestyramine. Main side effects are gastrointestinal, GI related bloating, flatus, interaction with other medications taken orally. Nicotinic acid. Main side effect is severe flushing. Taking aspirin 325 mg before may help. Fibrinic acid derivatives such as gemfibrozil may cause myopathy. HMG CoA reductase inhibitors. Statins such as pravastatin or atorvastatin. Lipidor. Most expensive agents but best tolerated, require liver function monitoring because can elevate transaminases, also may cause myopathy. Complications: disability from myocardial infarction, stroke, and lower extremity ischemia. Thank you.